because by the time they open their laptop, everything, you give them 1 second to take a deep breath. Yeah, please.
Good evening, everyone. I'm Dr. Thangamani, doing second year residency in Department of General Medicine, CMC Vellore. I'm going to present a e-poster on the topic of incidence and risk factors for stroke in tuberculous meningitis, a retrospective cohort study. Stroke occurs in 30% of patients with the tuberculous meningitis, as this detail we got it from the previous study meta-analysis. So our aim of the study is to assess the incidence of stroke in patients with the TB meningitis and risk factors for the same. So this study was a retrospective cohort study conducted in the General Medicine Department in CMC Vellore. All patients admitted with a diagnosis of tuberculous meningitis were included in the study for a total duration of 3 years from 2020 to 2022. So data was collected from the hospital records and analysis were done using a SPSS. So the study was approved by the Institutional Review Board. 157 patients were included in the study and survivors were followed up for a mean duration of 335 days. And we found that 35.5% of the patients had infarcts on imaging at presentation and 10.9% had a clinically evident new stroke after initiation of the treatment. So diabetes and older age were associated with a high risk of stroke. But when we did multivariate analysis, only older age was independently associated with a stroke. This is documented in other studies also. But other risk factors for stroke in tuberculous meningitis such as diabetes, smoking, and hypertension were not found in our study. So the effect of age and metabolic risk factors suggested a role of atherosclerosis as well as endoarteritis in the development of stroke in TB meningitis. So the limitations of this study were, which is retrospective and patient follow-up for a short period of time. So as a conclusion, I'm saying from this retrospective cohort study, 35% of the patients had imaging evidence of stroke at baseline and 11% developed a stroke after initiation of the treatment. So age as an independent predictor of stroke in TB meningitis. Thank you.
Look at the literature for this earlier. So for me, it's well known that the single most important risk factor for complications, neurological complication in stroke is delay to treatment. So what is that onset to treatment time delay is perhaps, did you measure it? So because that is the obvious thing that is there in the elephant in the room, but you have not even talked about it. Isn't it? If you start treatment early, of course you get better. If you delay it as much as 24, 48 hours, then the chance of things becomes much more. And that's been well recognized and described elsewhere. So you have not looked at the literature.
No, what you're saying here is you had 157 patients, of which 35% developed a form of stroke
At presentation, sir.
Okay, as evidence, but we are believing it is arterial, not venous. We are believing it is not capillary. Okay, no problem. But I've been trained to think in terms of tuberculous meningitis, to look at protein content in the CSF, which I was not seeing.
Yes, sir.
What is the protein content in the CSF? Is it more than 1 gram?
Can I get this?
So just for my understanding, so that what you are trying to say is how to go forward.
Yes, sir.
Because you got valuable evidence.
Yes.
Now,
Yes,
CSF protein content, that value I'm not getting, more than 1 gram. Or where is that? What is your value cutoff?
That mean was a 256, sir, CSF protein.
Mean was over?
256, sir.
It's okay.
Okay.
It's not something that we will, at least you give me a range. Now that means anybody more than 1 gram.
Yes.
That's one part of it. Because today, what do I teach? What do I teach based on this? A person who has got, because it is the penetrating vessels. As a result of the meningeal enhancement or meningeal involvement, it is not in the, it is in the base of the brain, not in the convex surface.
Yes.
And we are giving steroids for bacterial meningitis. Any cause, particularly H influenza is the only one we are supposed to give, but nowadays everybody gives it for all bacterial meningitis as such. Here, how many of them received steroids? Because our teaching is, if the protein is high, because I'm not seeing that value. And what is your indication for steroids? What is your indication for aspirin? You understand? Because in a critically ill patient, giving aspirin, there must be some data because you've got the stress ulcers and things like that. So have some idea of incidence and risk factors. I am looking at the risk factor is what? Male risk factor is age.
Age.
All are young, 35. Metabolic risk factors. You're saying that there atherosclerosis is there. What is your evidence for your conclusion? Atherosclerosis on what basis?
Since because of the old age, it's not only TB
No,
entered.
no. What is the evidence of atherosclerosis? Stroke.
No, sir.
That you're saying it's because of TB.
TB.
Work it out. Something, there is some message I'm not able to see what it is. And died is 14%, 14 people died.
Yes.
Alive at last follow-up 22. Okay, it fits in with that. Dama, what do you mean by Dama? Moribund. Discharge
That's
against medical advice.
advice.
Or that's death. Okay, okay, thanks.
Thank you, sir.